the peripheral vision, which is just as important. This peripheral vision is also very important for the patient, and we check the eye pressure. It may be elevated, but when we check the fundus or the retina of the eye, we are able to see the optic nerve where it goes out, that is 1.5 million nerve fibers which are going out from the eye, supplying the peripheral. Hello, I'm Dr. Susan Verghese, Medical Director of Smart Vision Hospital. So a lot of people ask, why do we need to go to an ophthalmologist? We can always go to the opticals and get our glasses. But especially after the age of 40, it is imperative that patients should come in for a routine eye checkup to the ophthalmologist. This is because we not just check the vision and the refraction, but we check the eye pressure and we check the retina. Now, why these conditions are very important is because people do not realize that apart from the central vision, there is also the peripheral vision, which is just as important. This peripheral vision is also very important for the patient to get about in their normal life. Now, if this patient has any family history of glaucoma or any other condition which could have caused glaucoma, then the peripheral vision of the patient keeps decreasing and coming down. Now, if this keeps deteriorating and coming down, then the patient's eye pressure also may have been going up throughout the whole period, which may not have been detected in this patient unless in certain conditions, which is called narrow angle glaucoma, the patient will come in with eye pain. Otherwise, there is no other visual symptoms or any other symptoms that the patient will complain of. So when the patient comes in for an eye checkup, maybe just a routine eye checkup, and we check the eye pressure, it may be elevated. But when we check the fundus or the retina of the eye, we are able to see that there is a change in the cup to disc ratio. Now, this change in the cup to disc ratio, when we are seeing, then we are alerted. We do an applanation tonometry. We check whether the eye pressure is normal. Then we do a field testing. We do the field testing to see exactly whether functionally the patient's vision has decreased. And also we do a test called pachymetry. So these two tests go side by side for us to assess whether the eye pressure is elevated or not. And also we also do the OCT test. And OCT is an optical coherence tomography. That will also tell me anatomically whether the retinal nerve fiber layer of the eye is thinned out. Now, these tests will give me a clear idea, along with gonioscopy, that is to check the angle of the eye, whether it is open or a narrow angle glaucoma, to tell me what sort of glaucoma the patient has. Now, glaucoma itself, if I have to tell you exactly what it is about, there is a fluid circulating within the eye that is called aqueous humor, which is circulating in the anterior part of the eye. That is produced by the ciliary body, and it goes and drains out through the trabecular meshwork. Now, that is like a sieve which is situated 360 degrees around in the eye. This sieve may get blocked. If that is blocked, now what happens is the eye is being a closed chamber. The optic nerve where it goes out, that is 1.5 million nerve fibers which are going out from the eye, supplying the peripheral vision to the impulses to the brain. So the very, very important thing is to recognize that the person is suffering from glaucoma and detecting it, and then of course giving the treatment, the right treatment for it. You cannot prevent it. So there many people do ask, is there anything that I can do to prevent glaucoma? No, not really. But if there is a family history of glaucoma and a family history of diabetes, then please do keep your sugar levels under very, very strict control, because that is going to affect. Also, lifestyle changes such as drinking and smoking should be avoided. And of course, with that, we will be giving drops, medication which will be given. That these drops, maybe one drop in a day, or maybe 2 drops, which will be given once in the morning and once in the evening. And this very, very important thing that has to be done is compliance to follow-up. So we need the patients to come for regular checkup so that we can see whether it is progressing, whether the target pressure has been achieved, and whether the patient is deteriorating, so that a more multi-drug method can be employed for glaucoma to be treated.